So we're going to launch in protecting family values. Go ahead, next slide. First, a disclaimer or information. We acknowledge that legitimate universal human rights address a number of serious human rights abuses throughout the world. Family Watch opposes harassment and violence against all persons, including LGBT persons. You will note that there have been many attacks from all the major news media on Family Watch saying the opposite of this, so we need to do a disclaimer at the beginning of our presentations. Now, I'm going to launch right into Comprehensive Sexuality Education in Africa. Next slide. And we're going to go to 3 direct threats to African families. The first one is Comprehensive Sexuality Education. And what I stayed up all night preparing for you is these are immediate threats right now. I'm going to give you more information on the international health regulations of the World Health Organization, which are due to be adopted very soon. And your nations have a very brief window to opt out of them. And the pandemic treaty, which can be adopted as early as this month in the next General Assembly of the World Health Assembly of the World Health Organization. Next slide. So just to make sure that we understand the deep threat from comprehensive sexuality education. Next slide. I want to start with my children, okay? We met these children in 2002 in Mozambique and felt like we should adopt them and make them part of our family. So I have a personal stake, my husband has a personal stake in what children are taught in Africa, because Amelia, who is over on the right, she is now grown. She married a man from the Congo, and she has given us 4 grandchildren. So they're going to be living in the Congo very soon, and they've lived in different African countries. Next slide. But it took us 7 years to adopt these children legally. There were a lot of roadblocks, but I believe there was a blessing hidden inside of that, because I came back and forth to Africa, and I started seeing for the first time, this is how I first saw the agenda of comprehensive sexuality education. My daughter Amelia came home with her backpack. I guess I'll stand over here because I'm kind of hidden from some of you. She came home with her backpack with an explicit graphic booklet showing how to have anal sex step by step under the guise of doing it safely with the condom. And I was just shocked by what I saw. Then I started seeing in the orphanages all these radical sexual teachings that were coming from outside of Mozambique. Next slide. Amelia's mother and father had died from HIV before we met them. I cared for their older brother during the last stages of his bout with HIV and AIDS. And this was unconscionable. As I was discovering comprehensive sexuality education on the ground in Africa, I went back to the UN, and there was an event by the Girl Scouts, and they wouldn't let me in because they said it was only for children and adults could not attend. And afterwards I went, and there was a stack of these booklets on the back table for all the children. This is a booklet for HIV-infected youth called Healthy, Happy, and Hot, International Planned Parenthood Federation publication. Next slide. And it teaches children that they have a right to sexual pleasure, even if they're infected with HIV, and that they should be able to engage in sex, licking, tickling, sucking, cuddling, just have fun and explore your sexuality. But what is unconscionable to me is the next slide. And I have a copy of this here if you'd like to see it with your very own eyes. Some countries have laws that say people living with HIV must tell their sexual partners, with an S, partners, that they are infected with HIV. These violate the international human rights of those people, meaning they do not have to tell their sexual partners they're infected with HIV. Can you imagine? This is child abuse, it's health abuse. This is what is the sexual rights approach to sex education. And this is advancing sexual rights at the expense of sexual health. Next slide. Now, maybe many of you have seen this quote from Hitler that says, "He alone who owns the youth gains the future." They're after our children. They're coming after them because our children are the future of our nations. Next slide. And CSE, this is the Sexuality Information Education Council of the United States, is writing a lot of the sex education manuals along with International Planned Parenthood Federation for all the world. And here's what they think about sex education. It's for social change. It's not about health. It's about social change. Next slide. They say, if you care about abortion rights, then you should care about sex education. Next slide. Then they say, if you care about LGBT rights, then you should care about what? Sex education, because that is their mechanism, their tool for social change. So comprehensive sexuality education is the #1 tool to change your societies from the grassroots up through the children. Next slide. If you have any doubts about this, please go to stopcsc.org, watch our documentary, do it anyways. If you haven't watched it for a while, watch it again. Send it to as many people as you can, because this has stopped comprehensive sexuality education in many places. There's a 10-minute version and a 30-minute version, and lots of language that you can choose from. Next slide. So I'm going to just take you through 2 programs. Hopefully these are newer, because many of you have seen my presentation, so I keep trying to show new manuals. But this one is Comprehensive Sexuality Education for out-of-school young people in East and Southern Africa. And look at who is funding this. UKA, the Swiss Agency for Development and Cooperation, UNFPA. Next slide. And this is to improve and expand comprehensive adolescent sexual and reproductive health services in the following countries: Botswana, Lesotho, Malawi, Namibia, South Africa, Swaziland, Eswatini, Zambia, and Zimbabwe. Next slide. This manual is intended for age 10, beginning at age 10. Next slide. And they do what I call values deconstruction. This is in almost all the manuals we see, to explore the influence of family, culture, religion, and friends on their values and examine how they decide on their values. They help them shape their values. Next slide. What did you learn about, and when is it okay to start having sex? From your culture, your friends, your religion, your family. Go through the same process for when it is okay to start having sex. You need to decide with all these different views, when are you going to have sex? Not delay sex until marriage, right? Because of culture, religious beliefs, and attitudes, sex has been a difficult or taboo subject to talk about. We need to learn to talk about sex more openly. Your religion is closed about it, your parents, though. Here, we're going to talk about sexual things. Can you imagine? This is a matter of national security. When you have outside entities like the United Nations coming in, infiltrating your out-of-school programs, and talking to your children about sexual, sensitive things. Next slide. And they want to desensitize them. This activity is in most of the manuals, and this is a tactic for grooming children that even pedophiles use. And it's to desensitize them. They want them to feel comfortable about talking about sex. They want to list all the male sex organs, all the female sex organs. They should brainstorm all the words they know about these organs. They can be slang, scientific words, children's words, medical words, or vernaculars. The purpose is to build their comfort and ability to talk about sex, talk more openly about their sexual relationships. Most young people who have not had sex will have sex. So we got to talk a lot about it now, because you're all going to have sex eventually. Next slide. And then they teach children, sex is safe if you don't exchange bodily fluids. You can do what's called outer course. That means being sexually intimate without having oral, vaginal, or anal sex. It's a type of abstinence, and it includes caressing, heavy petting, and masturbating each other, because you're not exchanging fluids. Next slide. Describe the functions of the clitoris, vagina, uterus, and ovaries. Put up a poster of the sexual reproductive health system showing the external parts, And many of these parts are, thank you. I am getting dry here. Next slide. Next slide. If it will advance. And I'm sorry, this is very graphic, so I'm going to go to the next slide. But it's actually telling them which parts to touch to stimulate a woman. And this is for children. Then they have inappropriate role plays, and this is typical of all of them. Feeling sexually excited. What will happen to Betty's body? Well, and what will happen to her partner? He will get an erection, his heart may start beating. Betty, her vagina may get wet, her clitoris. Can you imagine teaching this to children? And you don't even know about it because it's in the out-of-school program. Next slide. So this scale represents two choices young people can make about having sexual intercourse, either to wait or to have sex. So they say, okay, let's brainstorm all the reasons to have sex. Let's brainstorm all the reasons not to have sex. You decide, it's up to you. You decide. Next slide. Okay, this is the Dream Tools Kit, Facilitator's Guide. This is from my government coming across Africa. My dreams, my choice. Next slide. And it teaches that sexual health includes sexuality, respectful approach to sexuality, pleasurable sexual experiences, and sexual rights. Next slide. This includes the international human rights documents and other international agreements. They're telling children they have an international right to have access to sexual and reproductive health services. Next slide. And when they talk about sexuality, this is the World Health Organization's definition of sexuality. Next slide. Next slide. So they're allowed to seek and impart information related to sexual orientation, gender identity, all those things in that World Health Organization definition. And they have a right to receive sexuality education. You can't ban it. And have respect for bodily integrity. That has to do with their language advancing abortion. They get to decide for themselves. This is a right to decide to have sex as a child. Okay, next slide. They have a right to have the free choice of their partner, whether it be of the same sex or the opposite sex. Next slide. Next slide. Next slide. Next slide. I'll just go to the last one. They need to have the right to a pleasurable sexual experiences. Okay, this manual is intended for use, again, with age 10. This is for Malawi. Okay, now they've specified a specific country for the out-of-school program. Next slide. Notice on the right-hand side, Advocates for Youth, that is the youth arm of Planned Parenthood in the United States. UNFPA, SIDA, that's the Swedish Development Cooperation, Ministry of Labor, Malawi Ministry of Education. Next slide. Again, it's for youth starting at age 10 to protect sexual and reproductive health. Next slide. It has a lot of the same ones that we saw in the other manual, but now this is the out-of-school Comprehensive Sexuality Education Guide for all youth, all across the world, not just specific to Africa. And I hate to show you this, and hopefully it's blurry. They have a topless youth on the cover of this manual. This is pornography, and this is sexual abuse. And look at all the logos here. And note that the HRP at the bottom, Planned Parenthood is part of the HRP, but even the World Health Organization, UNICEF, that's supposed to protect children, has a picture of a topless girl on its manual. Next slide. Norway funded that particular guide. Next slide. And it sends them, it gives thank you to Planned Parenthood, to a transgender group, to a sex worker, prostitution group, and this is the group that created this manual. We don't have time to go through it, but this is the most aggressive SOGI, sexual orientation and gender identity promoting, guiding manual for the out-of-school programs in the world. Now, many of you are familiar with the ministerial commitment that was pushed in 2013. Because the UN diplomats in New York and Geneva would not accept comprehensive sexuality education when they learned what it was, they had to go around them and try to get through the ministers who didn't really know what it was. And they got them to all cheer. And one of the ministers that was there is Honorable Sarah Opendi of Uganda. And she just was the major host and organizer of the conference that many of us came from Uganda. And she says she feels so guilty because she was one of these people cheering, and yet she didn't know what it was. And now she knows what it was. Next slide. And it was a commitment to increase comprehensive sexuality education in 75% of the schools. Next slide. And these are all the countries that were part of that agreement, that all agreed, the health ministers or the education ministers, that they would implement comprehensive sexuality education. Next slide. And if you go to the UN's website, it's called youngpeopletoday.net. It's the Young People Today program that promotes this whole ministerial commitment. Next slide. It supports implementation of this Eastern Southern African ministerial commitment on access to comprehensive sexuality education and beware of youth-friendly health services. Next slide. And here are all the countries that were going to commit to this for another 10 years, because the other one expired. It was 5 years. Next slide. So we launched a huge campaign. We wrote letters to presidents showing them what this really was. And we managed to help. The following countries on the left did not sign on for the next 10 years until 2030. But the countries on the right all signed up for it until 2030. And they committed to get comprehensive sexuality education in 95% of their schools. We need your help in reaching these countries, because many of them, of course, would never agree to that if they knew what it really was. Next slide. So we have a whole website where you can see the new commitment, deviousesacommitment.org. And interestingly enough, after this new commitment was negotiated on comprehensive sexuality education, they added in the annex new definitions. And they had a definition for sexuality that was the World Health Organization definition that included sexual orientation, gender identity, eroticism, desires, and fantasies. We call that the make it mean what we want strategy. We'll get agreement, and then afterwards we'll redefine some of the terms. Next slide. Okay, so this is what I stayed up last night that I felt you needed to understand, because this is a pending deadline. This is a threat to the African family. It's the World Health Organization International Health Regulations. Raise your hand if you already know about this. I want you to see the very few hands that are here, because this is a binding document. Next slide. And I want to talk about two entities that are infiltrating the World Health Organization and really driving a lot of their agenda, including with the pandemic treaty and the World Health Organization amendments to their international health regulations. Next slide. When the pandemic treaty and the international health regulation amendments were proposed last June, at the same time, the head of the World Health Organization, Tedros, who surely got in that position because he helped legalize abortion in Ethiopia when he was a minister there, he used his capital to implore for all of the countries to agree to let the Center for Reproductive Rights become an official partner of the World Health Organization. He had a lot to do. I mean, they're trying to pass the pandemic treaty. He's trying to pass the amendments. Why did he take this time? Why was it so important to him that the Center for Reproductive Rights, even though congressmen from the US sent him a letter saying, we're going to pull funding, we'll pull out of the World Health Organization if you put that organization in there, because all they do is promote abortion? Why did he push and call for another vote and another vote until he got agreement that they could be in there temporarily on a trial basis? Next slide. Why do they care so much? Well, the Center for Reproductive Rights, you will see, is part of this coalition of the Interagency Working Group on Reproductive Health in Crisis. Reproductive health during pandemics is what's going to happen here. And this is a partnership. IPAS is one of the producers of the handheld abortion kit that you can maybe possibly even do it yourself abortions that they spread across Africa. Next slide. And the Center for Reproductive Rights is the mastermind behind the whole global international abortion strategies. They're at the center of it. This is their toolkit for advancing human rights-based universal sexual and reproductive health. Next slide. And they have 7 thematic areas of sexual and reproductive health: comprehensive sexuality education, abortion, and they want to stop harmful practices, which is code for any religious beliefs or actions against sexual orientation and gender identity. Next slide. Denial of women's autonomy disproportionately affects women and adolescents and people of diverse sexual orientations and gender identities. These are the marginalized and vulnerable groups. And this is who they want all the language regarding vulnerable groups in these treaties to apply to. Next slide. Next slide. Okay. So the Center for Reproductive Rights also has been working with UNFPA for years to advance sexual and reproductive rights, especially reproductive rights, the abortion end of that term, through the UN treaty body mechanisms. And my husband, who will follow me, will talk a little bit more about that, but you need to just have a basic understanding of what that is. Next slide. These are the publications of the Center for Reproductive Rights. They are the brainchild. They're the strategy behind reinterpreting all the human rights instruments, all the binding conventions, reinterpreting terms in those conventions through these committees that they get their people on to include abortions, CSE, what we call the triple threat, and the SOGI agenda. Next slide. So here's 5 reasons, just to kind of summarize and add a little bit to this, why Tedros pushed and needed to have them to be a part and have official status with the World Health Organization before the amendments to the International Health Regulations and the Pandemic Treaty were adopted. The Center for Reproductive Rights has led all the strategy globally to integrate sexual and reproductive health and rights into the work of United Nations treaty monitoring bodies. Next slide. They engage with the UN treaty bodies to interpret existing human rights treaties as encompassing SRHR. This is in their own manual, including access to abortion, contraception, and comprehensive sexuality education. They provide resources like step-by-step guide using the UN treaty monitoring bodies to promote reproductive rights, meaning to reinterpret the treaties to include abortion, really is what they're saying here. Next slide. Here is their step-by-step guide. You can even find it online, using it to promote reproductive rights. Next slide. Monitoring reporting, they document how treaty bodies address SRHR in concluding observations and general comments, thereby tracking the evolution of international norms. I don't know how to emphasize the significance of what this is saying and what they are doing. Because then they get, for example, the treaty bodies to say that the right to health includes comprehensive sexuality education, or the right to this includes all their agenda. And they get it done by multiple committees that are monitoring compliance with these treaties. And then they compile it all. And then they go around, because what their specialty is to litigate, to strike down laws that limit abortion or limit comprehensive sexuality education. They were the mastermind, I believe, in the striking down of Uganda's ban on comprehensive sexuality education. And so Tedros needs their expertise, because once the pandemic treaty is in place, which could happen very soon, And once the international health regulations, if your countries don't opt out of it, you have until July, I'll have the dates up here in a minute, then the CRR, the Center for Reproductive Rights, is going to litigate to show the meaning of the terms in those binding treaties, to change the meaning, to evolve the norms and the international standards. They highlight the relevance of treaty-derived international standards on reproductive and sexual rights in their oral and written legal arguments in these court cases. And the committee's concluding observations and comments can be persuasive evidence that you have to reinterpret these terms. So in the case of Uganda, when they manipulated an organization to file a lawsuit against their ban on comprehensive sexuality education, the judge did strike it down. And she pointed to what they showed her, the treaty body monitoring comments and observations that said now comprehensive sexuality education is an international right for children. So here's my question. Is that true? Is comprehensive sexuality education an international right for children? Raise your hand if you think it is. Raise your hand if you think it is not. It is not. Treaty body monitoring committees have no authority to create new rights, to reinterpret treaties. Yes, they're giving a mandate to interpret, but that mandate says it's non-binding. What they do is not binding. It's not jurisprudence. It shouldn't be used in court cases, but they do it anyways, and they've struck down many laws. Next slide. So here's all the committees. On the left side of this are the actual treaties, and on the right side are the committees that they manipulate. And then they tabulate and they create this manual that shows and that you can use, or their friends can use, to litigate in courts to strike down laws that they don't like. Next slide. The right to education, among other rights, includes the right to comprehensive sexuality education. And I actually deleted the footnote where they show all the different comments from the different treaty bodies that would say that. But it's not true. They can't create international law. They can't reinterpret and put things in treaties that the governments would have never agreed to if they knew that that's what they were doing. Next slide. So now we're going to go to the World Health Organization health regulations. They were adopted by, I should say, the amendments to these regulations. Your countries already are bound by these health regulations, but they adopted new amendments in June of last year. And nations must opt out by July 19th. This is our goal. After that, these new amendments are binding, and I'm going to show you what they look like. Okay? First of all, they redefine the whole idea of what are emergencies of international concern, because they created a new definition. And the new definition is for something called pandemic emergency, which means a public health emergency of international concern that requires, this is part of the definition, a whole of government and whole of society approach. What is that? Sounds innocent. Okay, we want everybody to help to stop the pandemic. That's what they know we're going to think this is. Next slide. But requiring a whole of society approach means it's a binding commitment. And what does that mean? Next slide. What that means is you have to involve in the decision-making, in the planning, in the law-making around, and in the policy-making when there is an emergency of international concern, which now includes a pandemic emergency because they infiltrated that. You have to bring in all the stakeholders that they've been training and indoctrinating, the youth, the sex workers, the vulnerable people, the LGBT people whose rights are going to be marginalized, and they get to start making decisions instead of the government about what's happening with your laws and policies when there's a pandemic emergency. Again, they changed the meaning of a public health emergency of international concern by adding in many places, including a pandemic emergency, which again, the definition requires a whole of society approach. Next slide. We could go into more depth than that, but I'm almost out of time, and I only have time to touch on these, and we can discuss more later. But now we need to talk about the WHO Pandemic Treaty. It is scheduled to be adopted May 19th through the 25th at the next session. It's most likely to be adopted the 24th or the 25th. And if your countries do not opt out, they will be bound by this pandemic treaty. This one has very deceptive terminology. Again, this is pandemic-related health products. Next slide. And that's in multiple provisions. Next slide. What is it? What is the pandemic-related health product? Well, it's products that are needed for pandemic prevention, preparedness, and response. So that's before the pandemic and after the pandemic, during the pandemic. Basically, they should have said always, right? And it may include, these pandemic products may include without limitation. So you can add anything to this list of pandemic health-related products. Next slide. The parties shall take measures to achieve rapid scale-up of the global production of pandemic-related health products, access to such products, as well as reduce the potential gap between supply and demand during pandemic emergencies in all settings. Next slide. Access to pandemic-related health products shall be facilitated in a manner consistent with international law. Think of the treaty bodies that the Center for Reproductive Rights have redefined what international law really is. And I'd like to propose to you that the pandemic-related health products are meant to have a double meaning. Besides vaccine and the COVID things that you think it should mean, that it will also mean the abortion products and the abortion pills. Because Planned Parenthood and all their entities and UNFPA, and they have this big, huge coalition called the Reproductive Health Supplies Coalition, they've been crying and complaining that their stockpiles were stopped during COVID, and they have to get governments to prioritize sexual reproductive health services during pandemics. Next slide. Loaded term in there, universal health coverage. Next slide. Universal health coverage is defined in that treaty as people who have access to the full range, the full continuum of essential health services. Next slide. Particularly primary health care. Next slide. Well, a resolution just in July of 2024, this was not an accident, on human rights in the context of HIV and AIDS. Next slide. Which HIV and AIDS is a pandemic already. So imagine how that's folded into the pandemic treaty. It says primary health care and services in this resolution include sexual and reproductive health services, as well as education programs on sexual and reproductive rights. So this is abortion and comprehensive sexuality education. So you have to look at all the documents around the pandemic treaty that have been adopted by the UN member states to understand what definitions will be in these. Next slide. And then, unbeknownst to everybody else, a resolution was also passed at the same time that the international health regulation amendments were adopted, and everybody was busy with that. Nobody paid attention. But this health resolution that passed at the World Health Assembly talked about primary health care, which will include sexual and reproductive health. Next slide. Integrating sexual and reproductive health into primary health care is a fundamental component of universal health coverage. So what I'm trying to show you is that abortion is deceptively, and the abortion products embedded throughout the treaty through these double meanings. The abortion meaning, and which could also encompass CSE, is in all the documents surrounding the adoption of those that were adopted in different contexts. Essential healthcare services, next slide. Each party shall take appropriate measures with the aim to develop, strengthen, protect, and safeguard, and invest in all these things, but they also must maintain essential healthcare services while they're addressing all the other pandemic issues. Next slide. Next slide. Oh, and with a focus on primary health care. Well, what are essential health care services? according to the World Health Organization, which is implementing the pandemic treaty, next slide, WHO has included comprehensive abortion care in the list of essential health services. So there you go. It's abortion is part of those services, which are part of the pandemic treaty. Next slide. Primary health care, next slide. So primary health care equals SRH services, essential health care equals SRH services, and universal health coverage equals SRH services, and universal health coverage encompasses primary health care. It's like this circular thing where they go back and forth, and each one includes eventually sexual and reproductive health in multiple ways. Next slide. Essential healthcare services while maintaining public health functions as appropriate social measures during pandemics with a focus, again, on primary health care, which the Astana Declaration says includes sexual and reproductive health, which the Astana Declaration was endorsed in the resolution that was adopted at the same time as the international health regulations passed last June. Primary health care, develop, strengthen, and maintain a resilient health system, particularly primary health care, taking into account the need for equity. Equity is a term that's used throughout the promotion of sexual reproductive health policies and abortion. They have to integrate reproductive health into primary health care as a fundamental component of universal health coverage. Again, the World Health Organization website. Next slide. Then, the pandemic treaty creates what's called the global supply chain and logistics network, hereby established to enhance equitable, timely, and affordable, and unhindered. Those are the words that the Center for Reproductive Rights and all the abortion advocates always use about abortion, that abortion needs to be equitable, timely, affordable, and unhindered, no laws to stop it, pandemic-related health products. Next slide. Regional economic organizations. Why would the pandemic treaty have a provision that regional economic organizations can be a part of the treaty, in addition to states, or in place of the states that they represent? And what are they? Regional Economic Integration Organization means an organization is composed of several sovereign states and to which its member states have transferred competence over a range of matters. Greg's going to talk a little bit more about those in Africa, but this is the West African Health Organization, and they are harmonizing medicines and the registration of medicines, which you'll need for the pandemic, right? Through ECOWAS is one of the regional economic organizations in Africa, and there are several. Next slide. But those will include essential medicines. These are the countries that are part of ECOWAS. Next slide. And this is just an example. But they also are registering the abortion pills that need to be distributed, because those got stopped and all the other things related to abortion when the last pandemic happened. So next slide. International law. The sovereign right of states to adopt, legislate, and implement legislation within their jurisdiction is respected. National sovereignty was a big issue. People wanted this statement. But the rest of this paragraph undoes that, what it says at the beginning. If you keep reading, in accordance with the Charter of the United Nations, the WHO Constitution, and the principles of international law. International law is redefined by the treaty body committees as compiled, and all the different statements and comments and general observations by the Center for Reproductive Rights. Next slide. So they can litigate and change the meaning or develop the meaning of the terms within the pandemic treaty and the pandemic health products and the international health regulation amendments and so forth. Tell your governments that they can just postpone it while they look into these things. I can send you the slides, I can send you the proof, but they can just say, we need more time to analyze it. They're still part of the health regulations because that was existing before. They can just opt out of the amendments, okay, until they can really scrutinize what's happening here, okay? And then with the pandemic treaty, again, you could do the same line of encouraging them to opt out of both of these things very, very soon. Thank you.
Thank you. Big hand of applause for Sharon Slater.